Hi, this is Dr. Jonathan Terry. I am going to be speaking with you today about the topic of integrative psychiatry. This is one of the topics that I am commonly asked to speak about when I'm invited to do a public speaking event, and it's also one of the most common topics that my residents and medical students bring up. Even though this is a topic that is not really tested too much, say on board exams, it's something that patients want to know about all the time. So I'm quite happy to share with you some of my background in this as both a board certified psychiatrist as well as someone who has additional certification in integrative medicine. In this topic, I'm going to be sharing with you the evidence basis for many different integrative modalities and treatments and how this might fit in with our standard of care recommendations. Now, keep in mind, most of what we're going to be talking about is not necessarily standard of care, but it might be, say, adjunctive treatment. For example, we'll be talking about things like exercise, diet, nutrition. What physician wouldn't want you to do those things? But we might be talking about topics as well, say like anxiety and depression, where medications and established psychotherapies would be considered more first line or more standard of care. In this presentation, we're going to take you through the following areas. I'm going to start by talking about what would be considered an ecological assessment, a different way to kind of look at a patient or look at a psychiatric problem set, as well as how we might develop integrative treatment plans. From there, we're going to transition and we're going to talk about our specific integrative modalities and the related evidence. And then we'll take a quick look at hormonal interventions, integrative treatment for anxiety, then depression, then psychosis, hitting on some of the big areas within psychiatry. And finally, we'll get to some cases. Now, you'll notice, of course, of the many different headers and subheaders, say in the Diagnostic and Statistical Manual, I'm only touching on some of them here. But as you will understand, integrative medicine is really about making biochemistry within the body more efficient or work better or help to improve some of those processes. If we go back to things like methylation, for example, that we'll be talking about, these things that we learned first year of medical school and then forever forget, well, they're still going on inside the body. And so some of the things we'll be talking about will be ways to address those, which might help out in a wide variety of patient presentations. Speaking of patient presentations, let's take a look here at this patient who is somewhat creepily looking at us from the middle of his clip art image. And the patient might present, say, with something like major depressive disorder. Now, what does that mean? Does that mean that the patient has a Prozac deficiency? Probably not. But some of the things that it could mean, for example, is, well, maybe he's got something going on with like inflammation. Maybe things are going on in his family. Maybe he has genetic or epigenetic influences or spiritual deprivations. Maybe there's micronutrient deficiencies or even skill deficits, which might be more of a therapeutic target. Someone who I look up to a lot in the field of integrative medicine and integrative psychiatry is Dr. Scott Shannon. Dr. Shannon, in his handbook of complementary and alternative therapies in mental health, and this is an older version of it, he talks about these 7 principles of ecological assessment. And what we're really doing here is making an effort to evaluate the whole person and the different realms of his or her life: environmental, physical, emotional, mental, social, spiritual. And what this might mean is that within the environment, that can include things like the physical environment that a person lives in. Are they in a toxic place? Is there chaos, disorganization, clutter? Are they someone who's commuting, say, through a smoggy city as they're doing it? What's going on with them physically? Have we really looked at the family history? How is the patient's diet and nutrition, their sleep hygiene, their exercise, fitness, their body habitus, as well as supplements and medications? How are all those things playing a role? Emotional is the area that sometimes we take a look at, either psychiatrically or therapeutically. What's their emotional tone and attitude? Are they positive, negative, balanced? Can they experience emotions? Do they have a trauma history? Mentally is a little bit different than emotionally, because this might include more of the way that thoughts influence our feelings, more of the cognitive behavioral therapies, but also areas of like learning disorders, the patient's educational background. These are all huge. And we do see that patients in general with higher educational backgrounds experience mental illness and physical illness significantly differently than those patients who come from different backgrounds. Now, if we take a look at things socially, that's also going to impact a lot of what's going on with the patient. What's going on in their relationships? Do they trust things? What's going on in their family? Spiritually, do they have a sense of meaning in their life? Do they have a spiritual practice? Do they have, say, a connection to a higher power, or the use of prayer, intention, or a belief system? Then once we have those ecological principles, we can look for patterns of imbalance versus balance, looking at the patient's strengths, their relationships, their belief systems, their spiritual health, and really looking at the obstacles to healing. One of the books, another book that I think is a great approach to things, is this book that's called The Gift of ADHD. And we're seeing some of these topics come up in this idea of neurodivergence, where we're saying, hey, just because a child or an adult doesn't fit the mold, maybe they have something different. Maybe they have other talents, and there are other ways to bring out those strengths. I'm going to go briefly here so as not to read you this very wordy slide, but it is here for reference. And again, this is borrowing from Dr. Shannon that, in the development of an integrated treatment plan, there are all these topics we can look at. Just going off the bolded words: family harmony, relationships, social skills, diet, stress management, mood regulation, sleep, weight, and exercise, gut inflammation, toxic overload, joy and satisfaction, spirituality. The list goes on here, right? We've got really 21 topics: focus, pain, trauma, sleep, obsessions, compulsions, thought clarity. These are all areas that an integrative or ecological psychiatrist or family physician or anyone who wants to spend the time looking can find areas that we might choose to look at. Another way to imagine this is if we conceptualize medicine as kind of this disease model, we're really looking at the top of the tree, right? We're looking through these lenses of cardiology, orthopedics, neurology, urology. We're looking at the leaves after they formed. But what we're not looking at are the core imbalances and dysfunctions that can lead us there, as well as the root causes like genetic predispositions, diet, nutrients, attitudes. This should start to make sense. So where we're looking at in terms of both diagnosis and treatment is really this area here, more toward the bottom of the tree, this idea of the root causes. Now, what we're going to do is transition, and we're going to talk a little bit about the specific integrative modalities and their related evidence. I apologize. I know the font here is pretty small, but take my word for it. These are all images and words that might describe some of the different things, all of which could play a role in terms of mental health. So let's take a dive into the first one of those. And that one, not surprisingly, is diet and nutrition, right? It shouldn't surprise us that everything we put into our body is part of a biochemical reaction, or several thousands or hundreds of biochemical reactions. And those are just the ones we know. So if we can do it with pharmaceuticals, it shouldn't surprise us that we could also do it with food, which is actually the source of many of our pharmaceuticals. As I mentioned, there are hundreds, if not thousands, of different chemical reactions in the body. These reactions involve things like cofactors, enzymes, or catalysts, which really make the whole system work. Some of the things that we know about just in terms of brain function are things like folate, folic acid. That's one of the things that we give to pregnant mothers to ensure a proper development, proper nervous system development in the fetus. Vitamin B12 is one of the reversible causes of both depression and dementia. Thiamine is something that we give to people if they've had, if they're nutrient starved and their brain is suffering from too much alcohol use. Pyridoxine is interesting, vitamin B6. That one can cause neuropathies if you have too much or too little. It's what I might refer to as a Goldilocks vitamin, in the sense that you really need to be at that sweet spot. If we take a look just at zinc, my goodness, zinc is a cofactor for over 200 different enzymes. The list goes on. So really, there's just so many different factors that we can take a look at. As one specific example, I do want to highlight the role of folic acid, or vitamin B9. In this case, we actually have a pharmaceutical, Deplin, or L-methylfolate, which actually has an FDA indication as a treatment for major depressive disorder. One of the ways that this does this is if a patient is found to have a polymorphism or a certain copy of the MTHFR gene, then one of the things that they can't do is take dietary or synthetic folic acid and turn it into L-methylfolate, which is the version that's used by many cells in different reactions. So what Deplin does, or L-methylfolate, is it skips this whole process and goes straight to the bioactive form of folate that's involved in countless reactions and sufficient to where it has, again, gotten an FDA approval. Some of the research that we've shown is that, for example, in a traditional diet consisting of meat, fruit, nuts, vegetables, whole grains, People who follow that diet have a reduced incidence of depression. Likewise, patients who follow a Mediterranean diet, not surprisingly, also have a reduced risk of depression. Now, you might be saying, okay, if a person can, I don't know, afford good quality food and fruits and vegetables, is that a confounder? Well, absolutely. And people who can participate in studies may not be representative of the general population, but certainly as we look at the health outcomes that are overwhelmingly associated with, say, a Mediterranean diet, this is just another reason perhaps to consider it. One of the other things that we might look at is the use of omega-3s. Omega-3 fatty acids are implicated in coronary artery disease, inflammatory bowel disease, arthritis, asthma, Alzheimer's. Their benefit is believed to be due to their anti-inflammatory effect. Now, psychoneuroimmunology is something that we can call, besides just a giant word and a fantastic spelling bee word, this is really a separate talk. And what that looks at is this idea that many concepts of what we consider disease and what we call the brain, whether it's depression, whether it's something like Alzheimer type dementia, these different processes that we consider to be inflammatory, well, there's good data that does suggest that, yeah, these are inflammatory processes. In major depression, for example, we see increased amounts of interleukin-6 and TNF-alpha, both inflammatory markers, as well as high-sensitive CRP, another inflammatory marker. Depression results in a release of pro-inflammatory cytokines, and if a person's feeling depressed, they might often say that they feel like they have the flu or they feel down, that sort of thing. So that's important to keep in mind because it makes you wonder, okay, is the inflammation causing the depression or is the inflammation causing the depression? Or does it be a cycle where we see all these different things? So why omega-3s? Well, one of the ways to consider that is that omega-3 fatty acids in general are an essential fatty acid. That means we have to get them from our diet. And they're overwhelmingly anti-inflammatory, whereas omega-6 fatty acids, which we can also get from our diet from less good foods, as we may talk about it, those are actually pro-inflammatory. So as we're thinking about our diet, and we can choose, say, the celery or the potato chips, or the fatty fish versus the fried fish, that's going to make a huge difference in terms of the omega-3 to omega-6 ratio that's going on that we're putting into our bodies. In Japan, for example, we're seeing a ratio of about 5:1, versus in the United States, where actually we have a 20:1 ratio of omega-6s to omega-3s in our diet. And why is that important? Well, depression is going to follow much the same risk as coronary artery disease, where you have more common coronary artery disease in countries that do have that elevated ratio, like the United States. And those things, are correlated with depression, schizophrenia, dyslexia, dyspraxia, autism, and ADHD. Really just so many different conditions that are associated with this more inflammatory diet. One of the ways to break this down with this image of good sources overall for omega-3 fatty acids is the green structures here are omega-3 fatty acids, and the red ones are pro-inflammatory omega-6 fatty acids. Just some ways to look at it from the what we put into our body and the way that it's digested, in the sense that each of these fatty acids is creating signals that tells our body to either create more inflammation or reduce inflammation, which again is implicated in so many different disease processes. Now, this slide is really nice just for looking at the evidence, again, for omega-3s. We see there's evidence in major depressive disorder, postpartum depression, cognitive performance, psychosis, ADHD, major depression. The ADHD data is actually really interesting because we found that omega-3s have a similar effect size actually as stimulants in some studies. We're looking at a dosing in many people about 1.5 to 2 grams per day, essentially of EPA, which is one of the omega-3 fatty acids. You can look at your supplements or nutrition facts related to the foods that you're eating. And those higher doses of EPA really shows profound changes in terms of brain health. It's often associated with DHA, which is another one of the omega-3s, also very important. For the purposes of this talk, as a broad overview, I'm not going to go into a ton of detail. Omega-3s could be a talk all in themselves about how to dose, how to think about them. Now, if we look at vitamins and minerals just in general, there's a number of metabolic pathways that can affect a person's nutrition status. For example, a person can have an error in their metabolism. Maybe there's a single nucleotide polymorphism or a SNP that reduces their efficiency of essential fatty acids. There can be a deficiency in the methylation process. We talked about that earlier, and we'll talk methylation. We think about it in terms of one of the ways that the body packages molecules to kind of take out the trash and reduce inflammation. And, interestingly, methylation, we'll take a look at this later, is influenced by SAMI and folate. We talked about folate. We'll talk a little more about SAMI, both of which have implications in treatment. There could be epigenetic alteration of gene expression from a nutritional deficiency. For example, if someone's on a high-fat diet, perhaps the inflammation is interfering with their ability to follow through and to activate the genes responsible for deactivating that inflammation. Likewise, if there's long-term latent deficiency of a specific nutrient, for example, omega-3s, that's associated with a higher risk of postpartum depression. If we look at the data, more than 50% of Americans, that's referring to people in the United States, not all of North, Central, and South America, do not meet the basic intake requirements for one or more of vitamin E, calcium, magnesium, or vitamin A. We talked about folate a bit earlier, and folate, interestingly, we talked about how Deplin can be indicated for major depressive disorder, really fascinating. There's several theories for why this way it may work. One is that it converts the Deplin, or the L-methylfolate, is the bioactive form of folic acid. The other is that it may independently seek to lower homocysteine. And we'll talk about that a little bit more on the upcoming slides. Likewise, if we look at vitamin C, which is readily available in our diet from any number of natural or synthetic sources, vitamin C was in acutely hospitalized patients found a 34% reduction in mood disturbance. It has benefit in pediatric major depression, and a single dose of high-dose vitamin C helped patients with bipolar disorder. This is going all the way back to 1981, which is really kind of incredible that we have been looking at this for this much time. It actually has a similar mechanism. In 1984, it was described as having a similar mechanism as lithium, which we still use, and arguably vitamin C is considerably safer for most patients to take. Now, if we look at even just a multivitamin, if we look at following, say, the New England's fair game as well for this perhaps, but especially the New Zealand earthquake, participants who took a multivitamin during this period had better mood, less anxiety, more energy than those who didn't. Likewise, a multivitamin significantly reduced mild psychiatric symptoms. Why is this important? Well, our mild psychiatric symptoms are actually the ones that are hardest to treat in some ways. If we look at our big NIH-funded studies, such as the STAR-D, those who have the most severe depression tend to respond great to antidepressants. Those with more mild to moderate symptoms really don't respond as well. One of my favorite things for all of you who might want to live a little bit longer, multivitamin use is associated with longer telomere length. Telomeres are by many considered to be one of the ways in which our chromosomes show aging at a cellular level. So this can perhaps be, I don't know, the fountain of youth. Might be a multivitamin, I don't know. Now, we talked a little bit about MTHFR, specifically, which we'll get into a little bit more. MTHFR we can think of as one of the enzymes that's responsible for turning dietary folate, or vitamin B9, into that L-methylfolate, the useful version of it. Now, we can even see in popular or standard of care resources, such as Stahl's Atlas of Psychopharmacology, he does talk a little bit about how L-methylfolate regulates the synthesis of serotonin, dopamine, norepinephrine. Certain genetic malformations that are actually pretty common in the general public are associated with major depression, schizophrenia, bipolar. And so there are several ways that we can go ahead and approach this. I do want to mention on the slide, not surprisingly, again, there are studies pointing to vitamin B6, B12, vitamin D, folate, B9 we're talking about here, vitamin C. There's data linking each of these deficiencies to a greater risk of mental illness. Now, I will often joke, well, this slide will be on the test, but this shows you really just the complexity of this process of the methylation cycle. And here's MTHFR, and you can think about what's going on here, all these different chemical reactions as something goes around and around the cycle. And what's happening as our body goes through these different chemical reactions is there different pieces that are getting picked up. We'll call it, for simplicity, different trash, different inflammatory molecules like homocysteine that these cycles help to convert and get rid of through various mechanisms. In this case, we're looking at methylation. So homocysteine in general is considered to be inflammatory. It's a marker of cardiac risk. It's a marker of systemic stress. This is one of the systems that helps to lower the temperature on that fire. One of the other ways that we get there is through vitamin D. Now, vitamin D is interesting because when you study it in huge populations, the effect sizes wash out a little bit. So you'll have these small studies that say, hey, vitamin D is awesome. It's associated with, the expression of dopamine, norepinephrine, and epinephrine. Well, that's, straight physiology. Low levels of vitamin D in the third trimester are associated with outcomes in those children later in life of increased incidence of schizophrenia. Supplementation in the first year of life decreased that incidence. It can correlate with dementia, cerebrovascular disease. You're getting the idea here that there are these components that are needed by brains and bodies, and we're just not getting them through our lifestyles and diets as they stand. So I'm not suggesting everyone, jump out and go ahead and, start supplementing and, buying out the whole rack of nutraceuticals, but rather really just thinking about, okay, what is mental illness? What are these things we're diagnosing? And really, are we looking at treating the smoke where, okay, this is what we see the depression, or are we treating the flames, the inflammation that might be causing it? Just some things to think about. If we look at the brain here, this is a diagram that I really like from a 2014 study taking a look at just all the different places that vitamin D plays a role in brain health. This ranges from things like vascular stress and blinded stroke, neuronal death associated with brain atrophy and declines in learning and memory, as well as amyloid beta and tau protein deposition, which are implicated in Alzheimer-type dementia. Now, let's take a look. We're going to transition again, and I'm going to guide you into the other types of integrative treatment. So yoga is something that many of us like to do if we can if we can move. Many of us would like to be better at yoga, myself included. Yoga is something, because it's so readily available, it's also really well studied. So it's associated with improvements in blood pressure, cognition, respiration, cardiovascular risk, reducing BMI, right? It reduces weight with not a lot of cardiovascular movement, reducing diabetes. It's associated with improvements in PTSD, depression, schizophrenia, ADHD, sleep complaints, all these different things. So something to think about in terms of our exercise, right? It's not all about just hopping on the stationary bike or going for a run, but there's also something about these slow movements and putting the body through stretching and different muscle loading that's so important. Biofeedback is really interesting as well. This is something that is easy to study because biofeedback is essentially associating reward when a person performs certain ideas. It's something that's done under conscious control. And they can track things like temperature, muscle tension, heart rate, brain waves. And so an individual kind of might be hooked up to, say, something like an EEG, and they're actively changing their brainwaves by changing their thoughts or changing their thought patterns, or by doing different things with their body. So it's really interesting, hard to access, but something that I do see developing through things, even as like some of the wearables that we see. There's several ways in which, say, like an Apple Watch measures biofeedback. It tracks things like heart rate variability that we'll be looking at later in VO2 max. There are things like the Oura Ring, which tracks even more interesting components. So biofeedback, again, is a lot of ways of looking at sort of graphs, looking at data, changing our thoughts, changing our physiology by measuring and then adjusting. Neurofeedback is very similar to it. It can be used to, say, upregulate certain types of EEG waves that are expected to be, more beneficial in certain things. It's been tested in ADHD, substance use disorders, addiction, sleep, anxiety, depression, all of these different ideas. And what they will do is use these EEGs again to sort of balance out. The biofeedback could be for any system. Neurofeedback is specifically looking at sort of often brain waves, and it helps so that you can train your brain, so to speak, to be in modes that are most effective. So if I were preparing for this talk, maybe I would hook up to an EEG, see when I'm least distracted and most fluid with my speaking, and I would try to practice on screen getting more brain waves to correspond with the changes that I want to see there. Another application of similar biofeedback is this concept of heart rate variability. Now, there's many different companies actually that track heart rate variability. I mentioned the Apple Watch, for example, will measure that for you. One of my favorite companies is called HeartMath, based out of Ben Lomond, California, up in the Santa Cruz Mountains, a beautiful part of the world in the redwood trees. But early on, they started to see, okay, this concept of heart rate variability, essentially the beat-to-beat differences in heart rate are associated actually with less sympathetic arousal and improvements in overall health. So you can track on an EKG or an ECG, if you prefer, the different sort of beat-to-beat differences within the heart. You'll see here there are subtle differences between beat 1 and beat 2. This one might be, at 70 beats per minute, but then when we measure this is a little bit closer. This demonstrates a heart that's fluid, that's able to respond. So what we're really looking for is a high heart rate variability, which is associated with low risk, like we have on this bottom graph here. Whereas if we go to a lower heart rate variability, that demonstrates a person who's a little bit more tense, and they might be associated with different amounts of risk. Again, there's studies linking this cardiovascular health, immune system function, mood. Some believe that the heart's intrinsic nervous system actually goes to many places in the body. It's not just confined to the heart. One of the ways that this could be memorialized actually is through this example of Josh and Mabel. Josh, I believe, I might be a little bit off on my data here, but Josh, I believe, was one of the founders of HeartMath's kids, and Mabel was his beautiful, lovely, trusting dog. And what would happen is they would track Josh and Mabel's heart rate variability when they were together and when they were in separate rooms. And for any of you who have had dogs or loved on pets, this won't surprise you, but you'll notice that Mabel, when they go into separate rooms, that the heart rate variability looks pretty erratic and pretty bad. It looks more like that top graph of problematic. But then when Josh is in the room and they're happy and they're enjoying each other, my goodness, the dog's heart rate variability is great, as is Josh's. But then Josh leaves the room and we are back to problems. Now, for any of you who are in or have been in committed relationships and where that's felt like a good and healthy thing at the time, that's kind of a critical component, you'll notice things here as well, where a couple of 50 years, as they're sleeping overnight, you'll actually notice that their heart rate variability tends to sink a little bit. If you think about this, for example, an EKG measures heart electrical activity on the person, but if you're in an insulated room, the energy of the heart can be measured out quite a bit, even with the tools that we have now. So this is a way to suggest that, really the influences of the people around us are profound. And if you've ever been, say, in a standardized testing center, you can attest to this. It's a stressful place. Or at the DMV, right? You walk into the room and it just feels a certain way. And I kind of wonder, okay, is that related to what we're picking up on from all the electrical activity around us? One of the other things that has been measured, for example, is on the top, we have an EEG from mom and an EKG or an ECG on baby. And you'll notice that they actually become in sync in pregnant mothers. So really interesting kind of energetic stuff that we think about as being kind of esoteric, but really it affects us all. One of the other examples is this picture that was in Time magazine and Reader's Digest. Currently, it's used for sort of political purposes, which is another story. But this picture is from an article called The Rescuing Hug. And this article details the first week of a life of a set of twins. And apparently, these twins were in separate incubators. One of the twins was not expected to live. And a hospital nurse fought against kind of the hospital rules, placed the babies together in a single incubator. And when they were placed together, the healthier of the two threw an arm around her sister in this endearing embrace. And the smaller baby's heart rate stabilized and the temperature rose to normal. So really kind of profound stuff. This, I imagine, for people who pay attention, as if we have time in our medical lives and roles, it's incredible, this type of stuff that we all sort of know and accept to be true, but it's something that we don't talk about that much because it's something that's a little bit harder to measure. Speaking of things that can and can't be measured, let's talk about energy. Let's talk about modalities for energy. This dog here is in front of a bright seasonal affective disorder lamp. This is like a 10,000 lux lamp. I've actually got one in my office for the winter. When it gets a little bit darker. And light therapy is actually indicated for things like seasonal affective disorder, but also chronic depression, antepartum depression, premenstrual depression, all types of things where the body just isn't getting enough energy, at least from our optic nerves, which for anyone who's been in gross anatomy or is familiar with it, the optic nerves that come off the back of the eye are thick nerves that go really directly into input to the brain. And there's so much to be said for light. So much so that actually these lights carry a risk of triggering mania in patients with a risk of or a history of bipolar disorder. Bright light therapy has been measured to be as effective as fluoxetine in seasonal affective disorder. It's considered to be safe and as an alternative during pregnancy. It's also a good adjunct to antidepressants in treating major depressive disorder. Now, if we take a look at other energy modalities here, this is where, again, some of the physicians in the room might say, hey, hold your horses there, Dr. Terry. And this is just to say, if we look at Reiki, pranic healing, systemic review found, hey, there's not a very good evidence there. For homeopathy, there was perhaps some evidence for functional somatic conditions like fibromyalgia, chronic fatigue, but maybe not for anxiety or stress. We don't have any really good placebo-controlled studies for depression. Transcranial magnetic stimulation, or TMS, is actually something that is readily available and uses an electromagnet to depolarize and then allow repolarization of cortical neurons. So it's almost like the way that MRIs get their imaging. And one of the ways that we found is with treatments, it actually does have pretty good success. It's not necessarily better than our antidepressant pills or therapy, but it is an alternative, and some people do tend to respond to it. Now, if we take a look at massage, who likes to get a massage, right? Like, what a great thing, whether you get it, whether you're self-massaging, kind of rubbing out your feet or your hand or whatever, or you go to get a massage, or maybe you have a loved one who cares for you in such a way. Massage is interesting because it's been demonstrated to decrease cortisol, but increase serotonin and dopamine in patients with depression. It's been measured to improve depressive symptoms in HIV-infected individuals, lowers anxiety, lowers hostility. Kind of hard to be upset with people when you're getting your lower back rubbed. So something to think about. But I wonder too, as we allow ourselves to relax, right? So the placebo control for studies like this would be having people just be in, a dark room with maybe, the sounds of water or fountain music, and that's associated with benefit as well. And just training our brain to be in a place where we are relaxed, right? I'm slowing down my speech just to think about what it's like to slow our roll for a bit and what effect that might have on our physiologic parameters. Now, if I were to get into one of my favorite things to prescribe, if you will, right? Didn't even need to go to medical school for this one. Exercise. Exercise is really an incredible antidepressant. And Dr. Hyman, who has been chairman of the board for a long time for the Institute of Functional Medicine, he's on faculty at the Cleveland Clinic. Exercise this is a quote from him, it's the best. And let's talk a little bit about what we see with that. Well, starting well before 1995, but we started seeing how exercise influences the release of dopamine, norepinephrine, and serotonin. We see that it has an anti-inflammatory effect. In some studies, it has an equal efficacy to sertraline. It's effective in reducing panic disorder. Even the American Psychiatric Association Task Force said that, hey, maybe exercise is actually more effective than antidepressants in achieving remission and preventing relapse in major depressive disorder. Really kind of an incredible thing to hear from an organization whose annual meetings have the exhibit hall filled with the drug companies, right? Like, where's the treadmill company or the walking shoe company? Where are they? Hypnosis and guided imagery are kind of interesting. A lot of sort of social, misinformation and sort of misperceptions about this. These are linked, of course, to to being most successful in people who are suggestible, who believe the treatment's going to work. But that's okay, right? There's nothing wrong with getting a good effect from something that you believe is going to work. And even in our drug therapies, the placebo group always has a response. So belief is incredibly important. That's a separate topic. But hypnotherapy and biofeedback were effective at improving irritable bowel syndrome severity. They've been tested in PTSD. Eye movement desensitization and reprocessing, or EMDR, has actually in some studies been shown to be as effective, if not superior sometimes, to medication. Guided imagery was associated with faster discharge from a post-anesthesia care unit in a group receiving some type of GI intervention. It's been studied in fibromyalgia. Stuff to think about, right? There's evidence to say that these might work in some people, especially the people who, say, for example, if you've got a patient who's miserable and doesn't want to take medications, well, maybe you've got something to offer still. Some of the things you can offer, and we do see this culturally actually in cultures that practice mindfulness and meditation, we see these as actually being incredibly useful as well. Mindfulness meditation, dialectical behavioral therapy is based on cognitive behavioral therapy and mindfulness. Again, this DBT is the top of the line treatment for patients with borderline personality disorder, right? So you have patients who might be impulsive or be self-harming, and teaching mindfulness is one of the things that really helps to maintain safety. Dance, music, and art therapy are also huge. Lots of evidence for music being important in mood, behavioral disturbances, dementia can be important for decreasing anxiety, greater functional impairment. Music can also allow therapists to access patients when language itself is a barrier. Say, for example, in disorders such as autism or dementia or learning disabilities, recovery from stroke. Just incredible what we can accomplish with music. Some of the belief for that is that music and its cross-cultural sort of adaptation is it's mathematical, right? It is something that can appeal in ways that, in universal ways, I should say, in which language might have differences. Dance movement is also shown to improve negative symptoms for patients with schizophrenia. Students have been demonstrated to have less depression. It can also be useful for helping with avoidance or numbing symptoms in PTSD. If we look at animal-assisted therapy, patients with pets have more exercise and a greater self-esteem. Again, kind of, well, is it because, they have to go take their dog for a walk, or is it because they, a lot of challenges with studying this, but there are some good review literature that say, yeah, in general, there are some really good outcomes from perhaps having a pet. We should talk about hormonal interventions as well, as we're kind of going down our list and just thinking about integrative approaches, right? Because you might say, well, if I go see my primary care doctor, my psychiatrist, and I tell them I have depression and I take one of those screening tools like a PHQ-9, I get a high score, I'm probably going to get, therapy or meds. One of the things that we don't consider is how much our hormones impact our moods. For example, if we take a look at triiodothyronine or T3 or levothyroxine T4, patients who are hypothyroid, their moods improve incredibly once their thyroid hormones are stabilized. We use T3, for example, as augmentation for antidepressants in patients who don't respond to them. It can even be used kind of as monotherapy, sometimes even for patients who do have normal thyroid function. It can be used for that indication. I should actually insert a disclaimer here that really should have been at the beginning of this talk, which is, of course, I'm not prescribing anything in this talk. I'm not telling anyone to go out and do these things. I'm just running through the evidence for educational purposes only, so you can evaluate and kind of make your own decisions. Here we have, for example, just a quick review of hyperthyroidism versus hypothyroidism and how each of these are associated with mood disturbances. The sex hormones are also highly implicated in both the diagnosis and treatment of depression. Testosterone in hypogonadal men has been demonstrated to have some antidepressant effect, as well as the ways that it might restore proper sexual function. Postpartum depression is thought to be caused by a rapid decline in estrogen levels. And there are some studies suggesting that, hey, if estrogen is given to patients with postpartum depression, there's actually significant improvements. Likewise, I'm not going to spend a ton of time here. I just want you to be aware that adrenal hormones are also something that can be highly implicated. Cortisol secreted from the adrenal glands is something that's often associated with stress, with weight gain, as well as with primary and secondary adrenal disorders. We do see DHEA as one of the steroid hormones, which really is a precursor to sex hormones, interestingly derived from cholesterol. We'll talk a little bit about that here in a second. But we do see that DHEA levels are associated with mood improvements, as well as, PTSD, schizophrenia, a whole wide range of things. As I mentioned, DHEA, and then things that we might recognize here, testosterone, different estrogens, they're derived from cholesterol. So if someone does have imbalances in their cholesterol metabolism, or say if they have their cholesterol very low, either because of dietary purposes or from medications, that's something that can go on downstream to impact the body's ability for the adrenals to have the tools that they need to go ahead and synthesize all these different hormones. Again, starts here. This is the first point on the map with cholesterol. So if there's a disturbance, there's going to be disturbances potentially downstream. Likewise, if we look at our pineal gland, which is associated with the pituitary gland, melatonin, for example, is something that's secreted by the pineal gland. Many of us are familiar with melatonin and its relationship to sleep and circadian rhythms. We use it for insomnia, jet lag, work, shift difficulties. Interestingly, it's not specifically helpful for depression, even though it's closely associated with serotonin, but it can improve sleep, which then might improve depression. Interestingly, there are some antidepressants that are derived as melatonin receptor agonists that have been shown to have some positive effects. If we segue here just a bit and take a look at our integrative treatment for anxiety, there's all these different things that used to be considered related to anxiety or I guess places where anxiety can show up. Anxiety disorders used to be a huge topic in the DSM. It's gotten thinned out a bit. So now the anxiety disorders, they are separate from our post-traumatic stress disorder and obsessive compulsive disorder, but there's still so much overlap. So if we take a look at anxiety in general, it really has kind of two main neurochemical pathways. It's associated with neurotransmitter imbalances, which we know because when we treat it with those, sometimes it improves, but it can also be associated with HPA, or the hypothalamic pituitary adrenal axis problems, where say a person has too much cortisol that we're talking about, imbalances in DHEA, too much adrenaline, where they feel like they're having these panic attacks, right? Where does that come from? So there's all these different places. Does anxiety, does it live in the adrenal cortex? Does it live in the immune system? Is it related to cortisol imbalance? I could talk for hours about just this topic. For our purposes, I want you to know that it's there. So one of the ways that we might look at treating anxiety, and this could work for depression as well, is this idea of 5-hydroxytryptophan, which is indicated by the number 2 here in this diagram here. It's a form of tryptophan, which is an amino acid precursor for serotonin. 5-HTP can be given as a supplement. It's associated with many of the same risks as serotonergic drugs, but it's usually pretty well tolerated. Likewise, L-lysine functions as a partial serotonin antagonist, can be associated with having sort of lower stress levels. Lots of different ways that we can get at the system without necessarily putting a person on, say, fluoxetine or sertraline or citalopram or escitalopram or paroxetine or duloxetine or venlafaxine, right? These agents where people do have these really kind of profound side effects and say a black box warning of suicidal thoughts. These are ways to address these systems in different directions. Likewise, GABA, or gamma aminobutyric acid, is an inhibitory neurotransmitter. It's actually something that we associate with alcohol, with benzodiazepines, baclofen, gabapentin, pregabalin, right? All of these different medications that we have work on GABA. GABA itself can also be given as an anxiety treatment. Likewise, magnesium and B6 have been studied and do have some implications. Inositol, which is often a part of the B vitamin complex, also has some great evidence, very well tolerated, as well as N-acetylcysteine. Well, what's NAC, or N-acetylcysteine? This is really interesting because NAC is actually given as the antidote for Tylenol or for acetaminophen overdose. One of the things that it does is it helps to promote the creation of glutathione, which is a potent antioxidant. When we're looking at acetaminophen toxicity, that's often due to a depletion of glutathione. So what we're doing essentially is replacing the precursor to it, which then allows the body to, again, take out the trash. If we think of oxidation as a major risk to cells, antioxidants or antioxidation is one of the ways we get around that. And N-acetylcysteine helps to promote, again, antioxidant production, which can be great for anxiety. There's some studies actually looking at it for trichotillomania, which is where children and adults will pull out their own hair as a stress relieving mechanism. Some other things that we might test here include like L-theanine, which is an amino acid derivative of green tea, crosses the blood-brain barrier, increases production of dopamine and GABA. Kava is a root native to the South Pacific Islands. It's been studied a lot. It is associated with some liver toxicity. So something to be aware of for those who are listening to this who might be taking board exams, be aware that that's out there. St. John's wort is from a flower, beautiful flower. We'll talk about this some more in our depression section here. Got to be careful with drug-drug interactions. Passion flower is wonderful. It's in a lot of teas and supplements. Really nice, as well as lemon balm, chamomile, rhodiola. These are all things you've heard of. What you might not have heard of are the studies that go ahead and back them up. So I've listed references from PubMed that they're below. Now, let's take a switch here and let's talk about depression or major depressive disorder or dysthymia or any of the ways that we might describe depression, this idea of it. And the way that we might conceptualize depression is if we look at a brain that has depression, it looks a lot like a brain that has anxiety, which is not surprising because pharmaceutically or pharmacologically, our treatments really focus on serotonin for both of those disorders. So an antidepressant is also usually a first-line anxiolytic. So if you can relate to Kelvin and Hobbes here, then, well, this section might be for you. So if we look at an overview, again, of depression, I raised the question at the beginning, how many of them really have a fluoxetine deficiency? Well, depression, it's not, again, borrowing from Dr. Hyman, it's not a psychiatric illness, but a systemic disease. And to treat it, we need to address the whole system, the ecosystem of the body. Depression has an economic toll of about $50 billion lost in GDP just alone in the United States. And the mildly depressed actually have a greater economic toll on society than those with major depressive disorder. There's several reasons for that. That's a talk in itself, but I think it's because of the number of people that do have mild depression. Since World War II, the risk of developing depression has increased significantly, and depression is associated with systemic inflammatory diseases or diseases that are linked with some pathophysiology in inflammation, such as hypertension, arthritis, coronary artery disease, diabetes, GI disorders, chronic pain, and so on. So rather than a specific disorder, I often think of depression as, again, the smoke, but not the flames. I see it as a non-specific response to some other imbalance. The body's telling us something is off, and we're going to show it through mood, but how do we address that? One of the things I actually forgot to mention earlier on when we were talking about psychoneuroimmunology is patients who take antidepressants, say patients with multiple sclerosis, their plaques are actually shown to shrink on MRI when they're exposed to, say, fluoxetine, right? It's an antidepressant, but they're also a little bit anti-inflammatory. Now, if we go to nature, one of our natural antidepressants, if you will, is St. Johns Wort, also known as hypericum and hyperforin, that has effects through serotonergic, dopaminergic, monoamine oxidase, and sodium channels, GABAergic activity. If this were a pharmaceutical, we would call it a sloppy drug because it does so many different things. There's a ton of studies that are comparing St. John's Wort specifically to all of these different medications, and it does really well. It holds its own compared to those medications. You just need to be wary of several things with St. John's Wort that I will talk about here in a second. So St. John's Wort, as I mentioned, it's a beautiful flower. It grows in these parts of the United States. It actually grows just north of where I'm located. I've seen it when I'm out hiking at Yosemite. It's pretty cool. I've got the waterfalls and St. John's Wort around me, so like multiple antidepressants. I'm just surrounded. You want to avoid dosing this with a lot of other medicines because of its its flower drug interactions or supplement drug interactions, as well as the risk of serotonin syndrome. We want to avoid using this with other antidepressants. There's dosing information that's involved as an option here, just some things to consider, but St. John's Wort is really incredible. And actually many parts of Europe, it's prescribed and used for depression before going to pharmaceuticals. You heard me mention SAMI earlier, or S-adenosylmethionine. I've got an article about this one up on my website. Actually, I've got an article about St. John's Wort as well, just because I get asked about these things a lot. SAMI is a metabolite of folate. It's an essential component of the methylation cycle, that big thing with the circles we looked at earlier that I said would be on the test. SAMI is a little bit pricey, but again, it has robust responses and really good comparisons to some of our best antidepressants. We talked about 5-hydroxytryptophan or 5-HTP earlier. I think I had the same diagram in there. I have this in my slide deck again because the slide deck is to be used as a reference. If people are going straight to the depression section, I want them to see that, hey, this is available. I also have some information there. Actually, when this was banned in the early 1990s, it was a depressing time, but it's just some information about that to think about, but it's safe for most people, again, when used cautiously, as we would with anything else we're putting into our body that alters our biochemistry. I don't combine it with antidepressants, but I might use for mild depression. Magnesium's a salt, much like lithium. It has similar effects on the HPA axis that we spoke about earlier. It's been studied for so many different things, ranging from mania to just cognitive status overall. Magnesium is something where you'll want to be mindful of renal dosing or making sure you're being safe with the kidneys, but really profound for anxiety and so many things in the body. Many of us are deficient in it. Chromium. Chromium as well is something that many of us are deficient in. It's been studied for atypical depression, say where a person has increased appetite, sort of these feeling changes between morning and night. It's not something I would prescribe, say, first line, even for a patient who wanted more integrative treatment, but it is something that is available and is in many, say, multivitamins, which we talked about earlier. Acupuncture's got some good evidence as well, but it's interesting because both sham and acupuncture and true acupuncture, say on the meridians or at the acupuncture points, did show some benefit in depression. I don't know if it's due to sort of local, say vasodilation type things, if it's related to anti-inflammatory effects, lots of things to consider. When combined with an SSRI, it was shown to speed up the response to that SSRI. It was also shown to be very effective in PTSD, mixed evidence for anxiety, stroke, tobacco cessation, alcohol abuse, but you can certainly find some studies that do suggest it's supportive. Short version, if you're with somebody who's trained in it and in a clean setting, it's unlikely to be a significant risk and certainly something that I might consider before other forms of treatment. So here again, I just have a summary slide looking at all the different things that we spoke about. And this is really tip of the iceberg, right? Because a lot of these are things that we would find in our environments, like bright light if we were not in the office or not in the classroom or wherever we are. Societies that spend more time outside tend to be less depressed and also have less, say, like multiple sclerosis. We're made to be outside, with appropriate sun protection and for our fragile selves. Now, recognizing the late Heath Ledger here, we'll take a look at integrative treatment for psychosis. Not surprisingly, this is going to overlap with many things that we spoke about earlier. It's going to overlap with things like nutrition and omega-3s. There's good evidence to suggest that, well, one, people say with chronic thought disorders or psychotic disorders have very poor nutrition, which may impact their mental status and their safety. People with schizophrenia on average die about 20 years earlier than others without schizophrenia. So huge health outcomes that are associated that, of course, are going to have an effect on psychiatric outcomes. There's some indication that gluten or the presence of anti-gliadin antibodies is more prevalent in patients with schizophrenia. There's a possible pathogenic role of gluten in certain types of inflammatory psychosis. Vitamin D levels, of course, patients with severe psychosis, severe schizophrenia have lower vitamin D levels, and low vitamin D levels, we said, are a risk factor, as well as folate levels are often low. That might make us think about MTHFR mutations and how much those might be present in schizophrenia. Several kind of books and things to think about here. Neurologist out of Colorado, Dr. David Perlmutter, wrote this book, Grain Brain, which is pretty great. It's sold very well and talks about some of the physiology behind these things. Now, I'm going to go ahead and share again, going back to Dr. Shannon's work. This is a case, just for example, a patient with depression. And this is a patient, for example, has flat affects, they've got changes in their sleep, decreased interest, feelings of guilt, the whole SIGI CAPS thing that medical students are required to learn. Now, of course, you might refer the patient to therapy and prescribe them an SSRI and be on your way. Or you might do the following. Maybe you'll consider prescribing sunlight. Get outside. Get a go hang around with a puppy for a while. Reduce screen time. Get exercise. Consider a multivitamin. Figure out if you have a good fit with your school and work, with your or you referring to the patient here, with specific intelligence and talents. Is it a good fit, or is the patient doing something that's not personally satisfying? Are they doing any type of recreation? What's their spiritual life like? Do they have things they're holding on to that might be better as forgiveness? Do they need to do a gratitude journal? Do they have a religious belief, or maybe attendance and community would be helpful? Volunteer work. I'm going to add something to this list where, if they're using substances, perhaps would 12-step be a useful source of information or of collaboration and community? This is another example. I'm just going to briefly show this here, but you get the idea. This is a similar thing except for anxiety. Here would be a similar example, again, borrowing from some of Dr. Shannon's work. He's the master, and I'm proud to give him credit for all these different considerations that could be looked at for ADHD. This is, part of the case example here. There's so many things that could be done in addition to or instead of standard of care practices. Again, recognizing that we do need informed consent here, right? Where if something is not the standard of care, a patient should be informed that, hey, if you see 9 out of 10 doctors, 9 out of 10 will tell you to do this. But if you don't want to do that option, I also have something else to offer you. So in this talk, over the last 57 minutes or so, we've talked about, in general, the ecological assessment and how that might replace sort of the chief complaint. We've talked about developing integrative treatment plans, and then we dove into specific integrative modalities and their related evidence, looking at hormones, integrative treatment for anxiety, depression, psychosis, and did a ballpark on some cases just to really expand the way that we might think about these disorders and our responses to them. Now, I want to end this talk with a quote here from Nikolas Johnson, who was born on February 4th, 1989, died on June 1st, 2001. Nikolas was a South African child with HIV and eventually AIDS, who made a powerful impact on public perceptions of the AIDS pandemic and its effects before his death at the age of 12. He's just really an incredible young person who died way too young. And at the time he died, actually, he was the longest surviving HIV positive born child. And one of the things that Nikolas said was to do all that you can with all that you have, in the time that you have, in the place where you are. And so I want to leave you with that and really challenge this idea of when we have patients presenting with these very, very common mental health concerns, are we really doing all that we can and using all that we have? How are we spending time with our patients and being present with them? There's so much to think about here, but I hope that this has been informative for an integrative look at psychiatry. Thank you for listening.